Thank you very much, Mr Principal Deputy Speaker, and thank you for the opportunity to update the Assembly today. Since the 7th of April, updates have been provided by myself and the Deputy First Minister, by ministers in the Executive, and the junior ministers brought forward the Health Protection Coronavirus Restrictions Regulations to the Assembly for approval. The common themes and threads across all of our updates have been the devastating nature of COVID-19, the need to protect our health service, the interventions which have been made by departments, and the need to follow the restrictions to keep safe and protect the NHS. Today we wish to update you on our latest review of the restrictions and our decision-making process for coming reviews. These have been discussed in detail by the Executive, and we are publishing Coronavirus, the Executive approach to decision-making later today. This is our 5-step plan to aid recovery and renewal. Our discussions have been guided and assisted by the inputs from the Chief Medical Officer and the Chief Scientific Advisor, and we have been grateful for their advice. The Economy Minister is also working on a further document dedicated to economic recovery, which will dovetail with this roadmap and be published subsequently in the coming days. The Executive agreed that now is not the time to lift restrictions, and we made that announcement on Thursday of last week. We also agreed that the time is right to set out our thinking and explain how we will approach decision-making, what we will take into account, and how we see restrictions easing. As of today, we remain subject to restrictions which no one wants to last a day longer than is absolutely necessary. These are measures we would not contemplate in normal times. We know that they are having a significant effect on people's ability to live their lives the way they and we want. So we wanted to set out for the Assembly today our thoughts on how we may move forward when the time is right. Just as there was no rulebook for putting the restrictions in place, there is no set pathway for lifting the restrictions either. Countries and jurisdictions are taking some tentative steps to lift restrictions. Some have published criteria and principles, and some have outlined a timetable. Each are different. And there are good reasons for that. Our decisions must be based on what is happening here, taking account of our particular circumstances within the Four Nations approach. Differences and nuances between the jurisdictions in the United Kingdom will emerge. The Four Nations discussions will, however, continue, and to that end we welcome the announcement by the Prime Minister on the establishment of a new joint biosecurity centre to monitor the levels of infection and identify specific actions in regions where spikes occur. The devolved administrations will participate in and contribute to its work. We will also continue to engage, of course, with our counterparts in the Irish Republic. We will remain focused on the health and well-being of our people, on our society and our economy as a whole. We will be driven by science. We will be driven by the need to emerge from the current arrangements in the safest way possible, step by step. This will require a series of judgments and decisions as we move through. Last week we considered very carefully the effect restrictions are having on our people. We know you want clarity on things that matter very much to you, such as visiting relatives, going to work, taking your children to school. We decided collectively that the time is not right for making major steps. We will continue to consider whether some modest steps can be taken, and if they can, we will do that ahead of the next review. Against the background of last week's decisions, we fully appreciate that people want as much information as we can give on the next steps. That is why we are publishing our document today, and we will move forward with care, step by step, with a clear goal of emerging from the situation safely. We must continue to avoid the health service being overwhelmed. COVID-19 spreads in a way which isn't visible in real time. A person who catches it today may not have symptoms immediately, but may well need hospital treatment in coming weeks. So the things we do today as citizens have an impact in the near future. And if restrictions are lifted too soon or in a way that we cannot control, we will see the negative results of that in the days and weeks ahead. So we will also keep our approach and document under review. As we move forward, we will address any oversights and make improvements to how we consider the issues that matter to our people, to their lives, families and livelihoods. We will not take a set-in-stone approach if there are things we can do better and do differently. COVID-19 spreads at a rate which isn't visible in real time either. Before the restrictions were put in place, each person with COVID-19 was likely to pass it on to 2 to 3 people. The time it was taking for COVID-19 cases to double was shortening, and we were faced with a growth which could have overwhelmed the NHS. The current transmission rate of each person infecting less on average than 1 has been achieved because of the restrictions being in place and adherence to them. We cannot allow the transfer rate to rise to uncontrollable numbers, and that is why we cannot lift the restrictions too early, and we must continue to ask everyone to play their part every day. The transmission rate, or R as it is more properly known, was key to the review last week. It will continue to be central to the judgments we will make in the coming weeks. Mr Principal Deputy Speaker, the Executive's document sets out the way in which we approach each review of the restrictions. We must work our way through on the basis of risk-assessed incremental steps and judgments. But it is equally important that we develop a very clear where we want to be as we emerge from this crisis. The document sets out an indication of how key aspects of life may progress through different stages as we emerge from this situation. They will not necessarily all move forward at the same time, and they will only move forward if it is safe to do so. In reaching our judgments, we will think about the outcomes we need for the health and well-being of our people, the economy and our society. We will preserve, rebuild and develop aspects of our life that are most important to us. We will think about what our people have been through, their experiences over this last few weeks, and how we can best assist with the adjustment to the new normal. And there will be a new normal. COVID-19 will not be beaten through restrictions. We may be living with it while clinical interventions are being developed. We may have to embed social distancing even further in how we live our lives and conduct our business as we emerge from the restrictions. We may need to take some steps forward and some steps back, but we will not be returning to the world as we knew it before COVID-19 for some time yet. And we were clear at the outset of the crisis that we could not entirely insulate ourselves or our economy. And we have lost loved ones, we have lost neighbours, our health system has been under tremendous strain, we have lost livelihoods, and some businesses, tragically, will not survive this. We have to consider the impacts this dreadful disease has had on families, on communities, the ways we live and the way we socialise. Which is why our document sets out very clearly the factors we will take into account in forthcoming actions and measures that have been taken so far. We will base our judgments on the health and well-being impacts of COVID-19, and we will have a clear focus on NHS capacity. We will take account of the impacts which restrictions have on non-COVID health and well-being outcomes. We will take account of the societal impacts arising from the restrictions, and we will take account of the impacts the restrictions have for our economy. Now, we know some will want us to set a date for lifting restrictions, but we will not be driven by a timetable, and we know that some will be disappointed by that. Many will want answers immediately around specific scenarios that impact them most directly. But our roadmap would answer every query. It provides an indication which people can use in looking ahead, in anticipating how the next weeks and months might evolve. It is understandable to want as much certainty as possible. And the Executive agreed last week on the need to enhance messaging around what people are already permitted to do within the legal framework, that there is scope for departments to be more clear with different sectors of the economy, citing examples such as construction and manufacturing. And it is not surprising that people are erring on the side of caution and not engaging in activities that are in fact permissible, safe and beneficial. This is understandable given the extremely unusual and challenging times we are living through. The Executive supported messaging aimed at giving people the knowledge and the confidence to enable them to live their lives as freely as possible within the existing legislative constraints and in line with public health advice. The Department of Health has committed to taking this forward with other departments. I want to stress again before handing over to the Deputy First Minister that our restrictions have worked and they have and are saving lives. We are asking a lot of our people, and we appreciate that the restrictions have health and well-being consequences too. We want everyone to be able to go out, visit relatives, socialise and enjoy everything that this place has to offer. We need to get people back to work when safe to do so, and we will get there. It will take time, but we will get there. And I would like to end with a word of thanks for everyone who is working hard to keep us safe, including those in our blue light services, the Police Service of Northern Ireland, the Northern Ireland Fire and Rescue Service and the Northern Ireland Ambulance Service, to those who provide our food, look after us in the NHS and who care for the vulnerable. We are grateful. Thank you.